Hi, Dr. Bernardo from New Jersey Plastic Surgery. Hi, Dr. Bernardo from New Jersey Plastic Surgery. Today we're going to talk about injectables. In our whole non-surgical armamentarium, we have a lot of different tools how to make you look better and younger with no surgery. There's a lot of confusion about all the different ones, what they're for, and why your provider will use one versus the other. So I'm going to try to explain these briefly so you know what they are and what they're used for. We have what are called the toxins. What you're probably most familiar with is Botox, and the other one we used is called Xeomin. Xeomin is made by a German pharmaceutical company called Merz, and it's a very pure molecule, but both of these are used to get your wrinkles on the forehead, the 11s, crow's feet, all those lines that come from muscle movement. What they do is relax the muscle, and when the muscle's not squeezing, you don't see those lines in the skin. The toxins are a major part of the injectable plan, and you'll see them used in almost every treatment plan that we do. Then we have what we call the fillers, and all fillers are not alike. I basically group them into three different categories. You have the volume fillers, which are used for depressions. If your cheekbones are sunken in, you can have volume replacement. In many areas of your face, these tend to be more firm, and they can last the longest, from 1 to 2 years. Common names you would have heard of are Voluma or Radius. These are both long-lasting volume fillers, so we'll put that into your program if you need to build up areas. We have the next group. These are medium fillers. Where would we use medium fillers? Medium fillers would be like we call the nasolabial folds between the nose and the mouth, the marionette lines between the mouth and the jawline. Or these are also very good for lips and other areas around. So these are the workhorse. The names you may be familiar with are Restylane, that was the first one, Juvederm, there's a little thicker Juvederm called Ultra Plus, and then there's a new one on the market that's been proving to be very nice, and that's called Versa. So Juvederm, Versa are your medium fillers. Then finally we have the lighter fillers. Names like Volbella, but one we like a lot is called Belotero. This is different because it has many different kind of crosslinks, which means it can blend into tissue like warm butter. Areas that this is very good for are its FDA approval for etched in lines and wrinkles, so we can put this right into those lines around the mouth or other areas of the face and basically fill them in like you're speckling a wall. And it's instantaneous. It's very neat to see. The other area that is very good for a lighter filler are those sunken hollows around the eye. Your cheek, as you get older, starts migrating downward, and it can leave a line here, and you see hollowness. And we can use this filler, Belotero, and we use a blunt needle so we reduce any bruising to make it safer and fill in that hollowness under the eyes. This can mimic surgical results, but it's a nice blend for the central part of the face. We look at what area needs which toxin or which filler and put it all into a program to make you look your most natural result. The best way to see how this is done is to look at a patient. So we will go do a consult on a patient who needs improvement of facial aesthetics, and we're going to use a combination of some of these toxins and fillers to get her improved look.